Hello, everyone. Thank you so much for joining us. We're going to go ahead and kick off today's session. We only have 30 minutes allotted, and we have a good presentation that we want to get through. So thank you again for joining us. My name is Jordan Fallon. I will be the host and moderator of today's session. I want to introduce our guest speakers today. With us, we have Dr. Travis Bias, Deputy Chief Medical Officer, and also David Bowers, Senior Product Manager for our Ambient solution. So thank you so much for joining us today. We have some poll questions throughout the session that we'd love your engagement with. You will have access to those throughout the presentation as we move through, so feel free to access those at your leisure. And then we also will have some time for Q&A. So if there's any questions during the session, please feel free to put them in the chat. And if we don't have time, we will make sure to follow up with them. Lastly, we are recording this session and we will make sure to get that out to you. With that being said, Travis, David, the floor is yours.
All right. Thank you, Jordan, and good afternoon to everyone. Thanks for joining us for our afternoon coffee series. So to jump in here, let's get the slides moving. We have three different pillars when we're thinking about Solventum and our health information systems division. We are going to be primarily focusing today on the creating time to care or clinician productivity solutions focused on capturing the care and the information from the patient visit. But we'll also be touching on how we eliminate revenue cycle waste and drive value-based care and how we're trying to build the bridge to bring that back to the capture components. So before we get into too much detail in our content here, we're going to start with a poll question to get a level set.
Just take a few moments, fill out that poll question for us. You will have access to this poll question as we move forward through the series as well. Just give it a few seconds. Okay, see some good answers coming through. We can go ahead and move forward.
All right, excellent. So I'm going to actually pass it over to Dr. Bias now.
Yeah, fantastic. Thanks. And this is actually the perfect slide because reduced provider burnout is at the top of the list for everyone so far in the poll, and you can keep putting in your responses. I put mine in, so maybe I skewed the results a little bit, but definitely that is we want to be clear that in all the world of AI buzzwords right now, there are lots of talk about solutions to problems, but we want to be clear about the problem that we're trying to solve, and that is really that our health workforce is being asked to do more with less. You know, clinician burnout was actually improving a little bit before the COVID-19 pandemic struck, but in 2020, burnout really took off, and health workers are really recognizing that this is the new normal. We're not going back to some pre-COVID times, and that's really, if you want to go to the next slide, Davey, that's really true globally. We're seeing this problem not only in the U.S. But around the world, and so from the UK. So higher income countries to lower income countries, you name it, there are countries that are dealing with similar problems in the fact that there is just more demand than the supply of the health workforce can meet. And so I think that's one thing that we really feel like technology has to be part of the solution to really make clinicians more efficient with their work and make sure that the clinicians actually have a decent experience themselves so that the patients ultimately have a good experience with the health system. Next slide, Davey. So we have seen, and this cartoon, you know, was drawn. This picture was drawn back in 2012, which kind of at the end of this first wave of electronic health record implementations. The EHR has been vilified for many reasons, some warranted, some maybe not, but it's really become the focal point of frustrations for clinicians. This was a picture that was drawn by a 7-year-old for her pediatrician, and it depicts her in the middle on the exam table with the pediatrician off to the left, with his back to the patient, focused rather on the computer screen. And this really, I think, highlighted and really captured a lot of frustrations that clinicians were having, where the technology and the computer screen was really taking them away from connecting with their patients. And that's ultimately our goal, is to kind of put technology further and further into the background so that clinicians can connect with their patients better, and like they would desire to. And the whole reason we went into medicine was not to type on the keyboard or click check boxes or drop downs in the electronic health record, but really to connect with patients, understand their stories, get to the root causes of their health issues. Next slide, Davey. So the electronic health record, there are multiple studies that show that for the majority of the workday actually for clinicians is spent in the electronic health record. So not spent on patient care, but spent on kind of clerical and I would argue kind of low value tasks for clinicians, highly trained clinicians to be conducting. So it can be anything from creating documentation to entering orders to mining their in-basket to look for lab orders or to respond to patient messages. And some of those patient responses are, of course, of high value, but there are a lot of tasks that clinicians are undertaking throughout the day that are really not using their well-trained brains to address. And so that is again one of our major the major areas of focus for our technologies to kind of reduce the amount of time and the burden that clinicians have in this electronic health record space. Next slide. So AI has been positioned as a potential solution for this problem, and I would argue that there is a lot of potential there. We're obviously very excited about AI and its many forms. We have been using AI in our solutions at various forms throughout over many years. Generative AI is kind of this newest, latest, most exciting component where AI can be used to really generate brand new kind of end products or outputs from inputs. And so this is a study that showed last year, well, I guess it's 2 years ago now, a year and a half ago now, that in the electronic health record in basket, if a patient messages me, I open a reply to respond to the patient. Generative AI is used to create a draft response for me to then edit and then send back to the patient. There was a study showing that actually the chatbot responses were and these generative AI responses were actually not only higher quality but more empathetic than human clinician responses in this study. And so that's not to say that we're going to just do away with all the physicians in organizations, but it's to say that if used properly and in the right ways, as a kind of an asset in physicians' workflows, it can actually be a huge boost and make them even more responsive to patients and better able to connect with their patients. So I'm not typing out this patient response from the beginning. I'm actually editing it and refining it and giving a response that's ideally more complete because I've not had to create it from scratch. On the next slide. There's also reasons for concern, right? With AI, in generative AI, we've seen there's the ability to hallucinate misinformation or to omit key information that's necessary actually in the electronic health record. And so we need to be just aware of this. And so there was a study done last year. I was actually a participant in this study where there was one bucket of physicians that was given a bunch of complex tasks to work through and to decide kind of what's the diagnosis. And then another group that was given the same complex cases, but they were able to use large language model chatbots to help them come up with the answers. And actually that group with the LLM chatbot did no better than the group without the chatbot. And so what that tells me is that we really need to bake this into our medical education systems. And again, be thoughtful about how and when we're applying this and make sure end users understand how they're using this. And I think that's really just to surface the fact that we've done a lot of deep user experience research with early customers and early stages of the product that Davey can tell you about that really I think ensures that we are targeting the use of our solution in the right way and supporting physicians how they want to use it, when they want to use this type of technology, and understanding that this is going to be used, these types of ambient documentation solutions are going to be used differently in different organizations, different cultures, by different specialties. And so we really have to be able to support the many ways this is going to be used. Next slide.
Try again. There we go.
I think this is my final slide, but basically because of these concerns, there's a lot of excitement about AI. There's a lot of concern about AI. Because of this, there's an acknowledged disconnect between organizational leaders and how excited they are about AI and frontline clinicians who I would argue are rightly still skeptical and kind of unsure about how and where AI is really going to support their work, and especially generative AI as of late. And so I think that's just something for us to acknowledge and be aware of, and as we are I guess, giving this technology as an option to frontline clinicians, we have to be clear about how it's going to improve their workday. And I would argue ambient solutions, most of you are probably very well aware of ambient documentation solutions now because frontline clinicians have seen it. It works, it is compelling, and they are demanding it from their organizational leadership. And I would argue now there are not many organizations where they are not trying out this type of solution. And this is really, the excitement has bubbled up from the grassroots, from clinicians, rather than being pushed down like a lot of technologies over the last 15 years. And so I think that's why we're so excited about this technology. Next, Davey. Hopefully we're at poll question. All right, cool.
Yes. So we talked about problems you're looking to solve. This question is going to be more focused on concerns that maybe you have heard about or experienced yourself.
Yeah, so we've heard many of these different concerns, and like I said, we've read about them, we've seen them, we've talked about them. I think it's right that we acknowledge them and just anticipate them really, and do what we can to mitigate those.
Give it a few more seconds since this is another ranking one.
Yeah, I like these ranking ones, Davey. We get a lot more useful information, I think, than making some.
Yeah. And sometimes it's hard. I mean, these may be valid concerns, all of them, so we wouldn't want you to have to just pick one. Right. So I think while you guys are finishing the rankings there, we'll dive a little bit more into the product and how we're actually looking to address some of the concerns that we put into that poll for you. So the way that our product works is that we have a variety of different modalities that are available for clinicians. So that way, wherever they are in their workflow, they have the ability to use ambient technology. So if they're at a desk and maybe there is a computer in a room, they could record that conversation directly with the patient in the room there and have their back turned to the computer in response to the image that Travis showed earlier. A lot of providers, though, are very much on the go, and there aren't computers in every single room. So we see a lot of utilization out of the mobile applications as well, where you can simply jump in, click into your schedule, record a note, and then you can also review the output of that note through both of these applications. We also have a Fluency aligned web application, which is, you can't record there. It's really just focused on reviewing the notes and allowing for copy paste for those EMRs that don't offer a direct integration for getting the note back in. Now, outside of the different modalities, we know that there is physician resistance to using AI documentation. What we try to do here to reduce the resistance is be very upfront around the types of information that we're collecting, both when we're recording the audio, but also presenting evidence back to the end user on what the note actually looks like, where from the conversation with the patient did the AI gather the information that then ended up in the note. So here's an example of what that looks like on the desktop. In a little bit, you'll be able to see kind of what that looks like on the mobile device. So again, evidence is key in building trust with the provider population and making sure that they feel comfortable jumping in, recording a note very quickly, and moving on to the next visit. Beyond just creating notes, though, we're getting a lot of feedback specifically at HIMSS this year that notes are kind of becoming almost a commodity when it comes to the AI-generated notes. So a lot of customers are saying that's great as long as the quality is, to par or better. They're fine with the note output, but what can we do with AI and leverage with AI to push additional workflows outside of just documentation creation? So this is another area where we're trying to push towards physicians, finding more value in the tool than just creating documentation. So these are two examples of areas that we're actually surfacing this information today. So on the left-hand side, we have automatic order detection, which can happen during the course of the conversation. So if you're talking to your patient, you say, we need to order you an albuterol inhaler, and we're also going to get you on some prednisone. Those orders will be detected and ushered and surfaced up to the provider, so that way they can move them over to the EMR or at least have a running list to remind them of the orders they might want to place before the patient leaves that office. Then on the right-hand side, we have coding suggestions, and we know that coding is something that is a a big burden for providers. It's something that 3M Health traditionally has, a lot of expertise in. It's our coding expertise there. So can we leverage that expertise to put ICD-10 codes in front of providers and be able to move those over into the EMR? But beyond just the ICD-10 codes, what about CPT and E&M levels of coding? And being able to measure the actual impact we see on some of the higher E&M level codes to see how clinical documentation can support billing for those higher pieces. We also want to address that each physician has their own style of note. So we know that overall, a lot of providers follow SOAP note format, but the way that they actually fill in the guts of that can be different. So one of the areas we focused on to get provider buy-in is letting them actually select how their note and style is going to look to make it feel more like they actually created it. So here's an example. I have a couple of items highlighted in green to show off what the preferences actually look like after selected. So do we want integrated or separated assessment and plans? Do we want it to be numbered, bulleted, or a new line per diagnosis? Do we want the follow-up to be at the end of the section or as a plan item? So we put it at the end of the section. You can see those instructions there. This is just one example of the different preferences we have available, but this has been really important for getting providers on board and feeling comfortable with using the technology. Now, ROI and measurement. This is where things get a little bit hairy since we're in still the early world of ambient technology. What we've been focused on a lot in the market is soft ROI. So like we saw in that first poll, people are still really concerned about provider burnout because attrition of providers and having to replace them and train, that does have significant financial cost to organizations. Decreased time spent documenting. So being able to actually look at data coming out of the EMR to show how much time are they spending in each of these charts actively documenting, and in what hours of the day are they doing that documentation. And then the other soft ROI that we've been very focused on are improved patient interaction. So getting a sense from the patients, how are they responding to this technology being in the room with them? Is there any resistance? We do see that there's around 25 to 30% of patients who, do say, no, I don't want to opt into this type of technology. But overall, we've seen a really great response to patients confirming that they're okay with it being used. And the interaction with their providers has increased because of that, face-to-face, eye-to-eye contact as you're going through the visit. But soft ROI isn't going to be enough for us forever. We're quickly moving in the market to ironing out what types of metrics we should be evaluating when we're looking at hard ROI numbers. So can we look at the number of denials and if we've been able to reduce them or the time to billing for different visits, both outpatient and inpatient? Can we look at increased RVUs as a measure of, better documentation or documentation at least that's capturing the level of care that was actually provided so that way you can bill appropriately? And then patient satisfaction is another one. I know we talked about patient interactions, but there are a lot of, dollars and cents attached to patient satisfaction, especially when it comes to different quality surveys and reports. So very important for us to continue measuring on that as well. And with that, that'll take us into our third poll question, and then we'll have a little bit of time here at the end for some Q&A. I don't know if everyone else has the same access, but seeing the numbers and the votes come in the chat is very cool.
Yeah, it's exciting. I'm glad, this hard and soft ROI. I mean, just to talk about that while people are putting theirs. I've seen the discussion very early on. Everyone wanted this hard ROI, these financial numbers to really prove that like my investment in this technology was worth it. And the more I've talked to CMIOs over the last year, I've heard a lot more openness. They're saying from their organizations and fellow executives, they're a lot more tuned into some of these like softer ROI, maybe some of these qualitative outcomes that they're seeing from this. Recruitment, retention, those things, those are costly. You can tie dollars to turnover for your physicians for sure, anywhere from $250,000 to $1 million a year for every physician lost. But there are other softer, more qualitative factors, I guess I would think that CMIOs are more saying like, hey, we're much more open to seeing that as a major benefit and tying that to this spending on this type of technology.
Yeah. And the one thing I should have mentioned earlier is, we're in a very unique position as Solventum. Like I had mentioned earlier, coding expertise is really what 3M Health brings to the table. Originally, M-Modal was very focused on the clinician-facing elements, and we have a really nice blend of the different types of solutions now that these companies have come together under Solventum. So we're in a unique position where, with our customers who are using our certain coding and autonomous coding aspects, we can actually help to build these types of hard ROIs by connecting that capture to code story.
Yeah, I think that's a great point. When you put up the kind of CDI and coding, auto coding pieces that we have plugged in, built right into the Fluency Direct and Fluency Align application, same thing that clinicians used to seeing. Bringing that kind of expertise, we're well suited to do that. We didn't just learn about generative AI 2 years ago and decide to build auto coding solutions. This is something we've been working towards for literally decades, and we're known in this kind of coding space. And so I think we're well suited to kind of bring that together with these types of technologies to bring maximal efficiencies for clinicians and CDI and coding teams.
Yeah, so jumping back into this poll question, very happy to see no one in the audience said increased patient visit volume was something that they were trying to get out of an ROI here. We really appreciate that because that is definitely not our goal. Our goal is to make providers more efficient, but not to necessarily see more patients. Maybe in time, but that's not the goal. We have a good distribution here, increased documentation of risk capture, increased staff time savings, recruitment of our clinical staff, and clinician experience. Very helpful. All right, so last slide before we jump into questions, and this is where we'll end it here today. This is just an example, or maybe more of an infographic to explain what capture to code really means. So when we say capture to code, it starts with the speech and the ambient side. Computer-assisted provider documentation is the ability to engage with providers in real time before that note's been signed on simple things like gaps in CDI, even things like dangerous abbreviations being used. Then it goes down into CDI, where we have an entire staff of folks who are looking through documentation, primarily on the inpatient space, to look for gaps in the documentation or care that CAPD may not have captured. And then wrapping all of that up with our coding expertise, the payment integrity, and then overall assessing the quality of the capture of the documentation. And with that, what questions does the group have for us?
The question about patience, Davey, I think that was something you mentioned earlier. For the most part, I think patients have been quite accepting because if you see and feel the result of your physician actually focusing on you because they're not nervous about typing everything you're saying while you're talking, I think it's a pretty compelling case to say, okay, I get to actually connect with my clinician again. And I'm not clicking away and saying, while a patient is actually telling me something that is kind of deep and kind of, intense maybe. A lot of times patients are telling stories and they're tearful. And I want to capture a lot of that, but I don't want to be, clicking away on the keyboard. One funny story I'll tell, because we have an intimate group here, Davey. My dad actually saw his primary care physician recently, and he noticed that he captured a lot more documentation and details than he would have liked him to. And so I think that's actually, I said, Dad, that's going to happen. When you use this type of technology, I think that's one of the things our physicians are seeing. They're actually capturing more details than they typically would because they're not waiting hours before they're able to sit down and type everything out that they remembered talking to the patient about. It's actually capturing a lot of that detail, which is reflecting the complexity of that patient. And that's really important for billing purposes, sure, but also for quality measurement purposes and for benchmarking accurately. And so I think that's something that patients are going to see more and more. I think the selling point's the connection with their clinicians, and that gets back to kind of normal, having a conversation with another human across from you. I think ultimately there will be actually other benefits to patients seeing more kind of open documentation of the discussion, and it's accurate and complete.
Yeah. Yeah, I'll share a personal story as well. Last summer, found a tick on me. I got diagnosed with acute Lyme disease, and my PCP has been trialing a bunch of these different vendors, and she used the technology during the visit, and it meant a lot to me to be able to make eye contact with her, have an actual conversation. You know, I wasn't well educated on acute Lyme versus chronic Lyme, what the symptoms were, so just knowing that she was on full focus on me gave me a lot of comfort in that weird time.
I think one other thing to note too is not every patient's going to be accepting of it, even maybe
Yeah.
years into the future. And so I think that's why we actually see this as kind of one of the many tools physicians may use to document, right? So front-end speech recognition and dictation is still going to be a thing. Like, Ambient's not going to like do away with dictation anytime soon. And so I think
Right.
that's it's a good point of whether patients or even physicians may not be open to adopting this or may not see that they need it. And so it's definitely just it's another tool. It's not something that's going to totally do away with all documentation headaches for now. Maybe in the future, the technology will be there where we'll kind of satisfy every little thing where I don't even need to open a computer screen, which would be amazing. Slowly but surely. Are there other questions, Jordan?
One other question.
All right, cool. Thanks. Thanks, John. Thanks, Patty. Appreciate it.
Yeah.
Thanks, Nisha. Appreciate it. Yeah, I think
Yes, thank you.
there's a lot of excitement about this technology, and I think we just the more that we deploy this across hundreds of users, thousands of users, the more we're kind of seeing how it might be used differently. But really, you can think of it as any specialty, any encounter where there are long conversations and there's a lot of narrative being created in the chart. That's where people are going to benefit from this. And so I think that's why we start a lot in primary care, where we have a lot of longer discussions, but we're getting into mental health conversations. Those are very long, challenging conversations and need to be summarized. You can't write, you can't just print out a transcript. That's not going to be helpful in clinical documentation world. And so there are a lot of places where we could save a ton of time from not having to create that documentation from scratch, and you're creating more meaningful and relevant documentation where you're capturing actually what was talked about rather than someone using a copy paste template maybe that's going to have a bunch of irrelevant stuff that in this day and age of note bloat and really trying to trim down the length of electronic health record notes, we can really get to like what was actually talked about and not have to copy forward a bunch of information that may not be relevant. All right. Any other questions? Comments?
If there are, please feel free to put them in the chat. Got just a minute left. Really appreciate the presentation, Davey and Travis. Wonderful. We really appreciate everyone joining us. We will be in touch with the recording and follow up with any additional information. Thank you so
Fantastic.
much again, and we will be in touch about the next afternoon coffee.
Thank you all for joining. Appreciate it.
Thanks, everyone. Have a great day.
Thanks.